One coin-sized spot no bigger than a quarter, pressed for 60 seconds a day, and you may begin to notice more energy, fewer nighttime trips to the bathroom, and less pressure in your low back. That's the promise behind what I want to show you today. 3 simple habits that restore performance, and 3 common habits that quietly destroy it. I'm Dr. Julia Morgan, a board-certified urologist. I work with men in their 50s, 60s, and beyond who assumed decline was inevitable, and then found out that small, consistent changes can make a real difference. If you want practical answers, hit like and tell me where you're watching from in the comments. Let's reframe the problem right away. Many men hear age and think it's the main reason for lower energy, weaker erections, frequent nighttime urination, or a dull ache in the pelvis and low back. Age is part of the story, but it's rarely the whole story. A more useful way to think about it is mechanics: pelvic floor tension, poor local circulation, and nerve compression. Picture a garden hose that's been kinked under a heavy chair. Water pressure drops. The same thing happens with blood flow and nerve signals in the pelvic region after years of sitting, stress, and inactivity. Over time, the tissues tighten, the vessels get a little less efficient, and your body's feedback loop becomes muted. That's why I want to introduce you to the perineal, or perineal area, the soft spot between the scrotum and the anus. It's a small zone, but it sits at the junction of important vessels and nerves. Gentle external stimulation there can encourage local circulation and a relaxation response in the pelvic floor. Physiologically, this type of stimulation may support nitric oxide release and local vasodilation, mechanisms supported by basic physiology and growing clinical evidence, leading to improved blood flow and nerve responsiveness. Think of it as sending a signal to the area that it's safe to relax and receive more flow. This is not a magic cure, and results vary, but for many men, the change is noticeable when combined with a couple of other daily habits. Here is the safe, non-invasive 60-second technique I use with patients who want a practical starting point. Choose a private, comfortable place. Your bedroom or bathroom is fine. You can perform this seated at the edge of a chair with feet flat on the floor, or lying down with a pillow under your knees. If you're seated, lean forward slightly so the pelvis opens. If you're lying, bend your knees so your hips relax. Make sure your hands are clean. If you prefer oil, warm a little safe, natural oil in your palms. Coconut oil, castor oil, or black seed oil are commonly used. Do an allergy patch test first. Rub a tiny drop on the inside of your forearm and wait a few minutes. If you notice redness, itching, or discomfort, don't use it. Locate the soft spot between the scrotum and the anus, the perineum. Use your index and middle fingers, not a single fingertip.
Apply gentle pressure, firm enough to test a ripe tomato, not enough to cause pain. The motion should be slow and deliberate. Option A, make a slow circular motion for 30 seconds in one direction, then 30 seconds in the other. Option B, press gently for 5 seconds, then release for 5 seconds, repeating for a total of 60 seconds. The goal is consistent, comfortable pressure and slow movement. Never forceful, never internal, never painful. This is strictly external stimulation. Stop immediately if you feel any sharp pain, bleeding, or unusual symptoms, and check with your healthcare provider. A few practical cues. Do this once a day at a time you can reliably make private. Right before bed is often convenient. Keep the pressure steady rather than erratic. You should feel a softening or increased ease in the area, but not pain. If you notice increased discomfort or new symptoms, pause the practice and consult your clinician. Avoid harsh soaps, topical steroids, or fragranced products in that area. If you have a history of pelvic surgery, active infections, open sores, or severe cardiovascular conditions, discuss this with your physician before trying the technique. This 60-second practice is one of 3 restorative habits I recommend. The second is short intentional movement, 10 minutes of walking after a meal. The third is a focused breathing routine, 5 deep cycles using a 4-2-6 rhythm. Inhale for 4 counts, hold gently for 2, exhale for 6. These 3 habits work together. The perineal stimulation sends a local relaxation and flow signal. The walk improves systemic circulation and metabolic support. The breathing calms the nervous system and helps the pelvic floor release. Consistent application is what builds change. 1 minute a day plus short walks and controlled breathing is better than an hour once a week. Why do these habits help? A short physiology explanation without too much jargon. The pelvic floor is a group of muscles and connective tissues that support the bladder, prostate area, rectum, and sexual organs. It also houses a dense network of small blood vessels and nerves. When those muscles stay tense due to sitting too long, chronic stress, or poor breathing patterns, they compress vessels and nerves. Compressed vessels mean reduced blood flow and less oxygen. Compressed nerves mean weaker signaling. Gentle stimulation of the perineal area and practices that encourage relaxation and circulation can reduce that compression, allowing blood vessels to reopen, improving perfusion, and nerves to transmit signals more effectively. While pills can temporarily enhance performance by changing blood flow chemistry, they don't directly address tissue mechanics, which is why combining mechanical approaches with medical care often gives the best outcomes.
Now, I want to pause for a quick practical tip. Try this tonight before bed. 1 minute of perineal stimulation, then a 10-minute walk the next morning or after dinner, and 5 cycles of the 4-2-6 breathing sequence. Small steps, big potential. If this resonates, drop a quick "ready" in the comments so I know you're with me. Let me teach the breathing pattern in a bit more detail because how you breathe matters. Sit comfortably or lie down. Place one hand on your belly and one on your chest. Breathe in slowly through your nose for a count of 4, feeling the belly rise under your hand. Hold gently for 2 counts. No strain, just a brief pause. Exhale slowly through your mouth for 6 counts, feeling the belly fall as the diaphragm pushes air out. Repeat 5 times. This pattern favors diaphragmatic breathing, which helps the pelvic floor relax and signals the body to shift out of the fight or flight state that tightens muscles and constricts blood vessels. Next, short walks. 10 minutes, ideally after a meal. Walking lightly increases circulation in the pelvic area, improves venous return, that's blood returning to the heart, and reduces local swelling. It also stimulates nitric oxide production from movement itself and helps with glucose control and mood, helpful for nighttime bladder control and overall energy. If you can't do a continuous 10 minutes, split it into 2 5-minute walks. The point is to interrupt sitting and get the lower body moving. It's important to balance what to build with what to stop. The title promises 3 habits that restore performance and 3 that destroy it. Let's be explicit about the destructive habits, why they matter, and what to do instead. Destroy habit number 1, chronic prolonged sitting or a sedentary lifestyle. How it harms: sitting compresses pelvic tissues and reduces blood flow, creating a traffic jam of sluggish circulation and tight muscles that dull nerve function. Replacement habit: get up every 30 to 60 minutes for a brief walk or standing break. Schedule short post-meal walks. Consider a standing desk or alternating positions to reduce continuous pressure on the pelvic region. Destroy habit number 2, over-reliance on quick chemical fixes, using performance pills or supplements as a long-term bandage without addressing mechanics. How it harms: medications may temporarily increase blood flow or alter chemical signaling, but can mask underlying tissue tension and circulation problems, delaying interventions that could restore natural function. Replacement habit: use medications under medical guidance while also addressing mechanics with the 1-minute practice, movement, and breathing. Discuss long-term plans with your clinician to optimize both safety and outcomes. Destroy habit number 3, chronic unmanaged stress, poor sleep, and dysfunctional breathing patterns.
How it harms. Ongoing stress activates the sympathetic nervous system, fight or flight, which constricts blood vessels and keeps pelvic muscles tight. Poor sleep interferes with hormonal balance and recovery. Replacement habit. Adopt a nightly wind-down routine that includes the 4-2-6 breathing. Aim for consistent sleep timing, and include low-intensity movement earlier in the day to reduce stress and improve restorative sleep. Notice that each destructive habit comes with a clear alternative. That's intentional. We're not scolding. We're offering practical swaps that reduce harm and build resilience. Let me give you 3 short, anonymized patient vignettes so you can picture how this looks in real life. These are brief summaries, not guarantees. Robert, 64, had been getting up 3 times a night to urinate and felt a persistent ache in his lower back. He started the 60-second perineal routine and a 10-minute walk after dinner. Within 3 weeks, he reported fewer nightly trips and less back stiffness. He felt more confident getting through his day without that constant urge. James, 70, had relied on medications for years and was frustrated by the plateau they created. He added the 1-minute daily stimulation and the breathing exercises. Over 2 months, he described better morning energy and said the medications worked more predictably, which allowed him and his doctor to reassess dosing with a plan focused on mechanics as well as chemistry. Daniel, 65, had a high-stress job and poor sleep. He began the breathing pattern nightly and took short walking breaks during the day, pairing these with the perineal stimulation. He noticed less pelvic tension and improved sleep quality, which he said translated into more consistent performance and less worry. These stories are illustrative. They do not guarantee the exact same outcomes for everyone. People vary. Underlying medical conditions change the picture. That's why I always counsel patients to combine lifestyle, mechanical approaches, and medical oversight when needed. A few practical safety notes and caveats I must emphasize. This technique is external and non-invasive. Do not probe or insert anything. If you feel pain, bleeding, unusual discharge, or sudden changes in urinary patterns, stop the practice and see a healthcare provider promptly. If you have active infections, open wounds, recent pelvic surgery, or severe cardiovascular issues, check with your clinician before trying this. Avoid harsh chemicals or strong topical agents in the area. If you choose to use oil, perform an allergy patch test first and stop if you have any irritation. If you're taking medications, particularly blood thinners or nitrates, coordinate with your prescribing physician before making any changes. And again, this video is for educational purposes only and does not replace professional medical advice. Consult your healthcare provider for personalized guidance.
Let's put it all together in a simple, realistic plan, the 3-week challenge. Commit to this sequence for 21 consecutive days and track how you feel. 1 minute per day, the perineal stimulation. 60 seconds of gentle external pressure with slow circular motions or 5-second presses and releases. Find a time that works and make it private and consistent. 2 daily movement. Aim for a 10-minute walk after a main meal. Breaks for walking during the day are fine too. If you can only build 2 short walks, that's acceptable. The key is interrupting prolonged sitting. 3 nightly breathing. 5 cycles of the 4-2-6 diaphragmatic breathing before bed to support pelvic relaxation and sleep. Keep a simple log. Did you do all 3 today? How was your sleep? Any change in nocturnal urination? Any difference in low back tension or confidence? After 3 weeks, you'll have a clearer sense of whether these habits are helping you and can take informed next steps with your clinician. Before we wrap up, a few practical troubleshooting tips. If you experience soreness from the perineal practice, reduce pressure and frequency. Try shorter sessions, 30 seconds, and build up. If walking is difficult because of joint pain, consider seated leg exercises, gentle cycling, or water walking as alternatives that promote pelvic blood flow. If stress is blocking progress, add 5 minutes of guided progressive muscle relaxation or mindfulness walking. Sometimes addressing mental load unlocks physical release. If you're unsure whether to combine this routine with a medication or procedure, schedule a consultation rather than guessing. I want to be clear about the role of pills and procedures. Some men will benefit from medications, injections, or devices, and these have their place when chosen carefully and used with medical supervision. My point is not to reject medical treatments. It's to emphasize that addressing mechanics, circulation, pelvic floor tension, breathing, and movement often amplifies the benefit of medical therapies and may reduce dependence on higher doses over time. That's a safer, more sustainable approach. You don't need perfection. You need consistency. These are low-risk, low-effort habits that send the body repeated signals to relax and restore flow. In clinical practice, I see men regain small, meaningful changes that add up. Better mornings, fewer nightly interruptions, less pelvic discomfort, and renewed confidence. The body is adaptive. When you give it signals that say relax, move, breathe, it listens. If you're ready, type "ready" in the comments or tell me where you're watching from. Commit to the 3-week challenge, 1 minute a day, a 10-minute walk, and 5 breaths at night. Subscribe for more practical, science-informed tips on pelvic and men's health, and share this video with a friend who may be quietly struggling. Your experience may help someone else to decide to try.
Finally, remember the safety reminders. Stop if you feel pain, bleeding, or sudden changes, and consult a healthcare provider if you have medical concerns or complex conditions. This video is for educational purposes only and does not replace professional medical advice. Your body remembers how to function. With attention, consistency, and a few simple habits, you can begin to restore mechanics and circulation in ways that support better, more confident living. Thank you for trusting me with a few minutes of your day. If you try the routine, come back and tell me what changed.